third heart sound S3, its clinical significance, and how to differentiate it from other diastolic sounds like opening snap or S-split S2. S3, or the third heart sound, is a low-frequency mid-diastolic sound which occurs during the rapid ventricular filling phase. There are three theories which explains the mechanism of production of S3. They are the valvular theory, the ventricular theory, and the impact theory. But what we need to know is the sound is produced due to the vibrations caused during the rapid ventricular filling in the early diastolic phase into a stretched ventricle. Pathological conditions where S3 can be heard are heart failure, ischemic heart diseases, dilated cardiomyopathy, valvular heart diseases like mitral regurgitation or tricuspid regurgitation, condition where there's hyperdynamic circulation like anemia, thyrotoxicosis, and some of the congenital heart diseases. Sometimes we might get confused with other diastolic sounds like opening snap or a split S2, but an opening snap which occur during mitral stenosis or tricuspid stenosis will be associated with the diastolic murmur and usually with a loud S1. And the split S2, which is best heard at the pulmonary area, may sometimes vary with respiration. But the easiest way is to compare the sound using the bell and the diaphragm of the stethoscope. S3, being a low-pitched sound, is best heard with the bell of the stethoscope, unlike other